Is a pH probe study necessary for infant GERD diagnosis? Imagine your little one struggling with frequent spit hups, coughing during feeds, or having trouble gaining weight. You might wonder what tests can help figure out if GERD is the cause. A pH probe study is one of the tools doctors use to diagnose gastroesophageal reflux disease in infants. It measures how much acid flows back into the esophagus by detecting when the pH drops below 4. This test helps identify acid reflux episodes and how often they happen. The test involves inserting a tiny tube with sensors through the baby's nose into the esophagus. The sensors stay in place for 24 to 48 hours while the baby goes about normal activities. During this time, a recorder tracks acid levels, giving doctors a picture of reflux activity. However, many infants, especially preterm babies, experience non-acid reflux. That means they have reflux episodes where the pH stays above 4, which the pH probe cannot detect. Studies show that a large number of reflux events in infants are non-acidic, so relying only on pH monitoring can miss important reflux episodes. Because of this limitation, some doctors use combined pH and impedance testing. This method detects both acid and non-acid reflux by measuring changes in electrical resistance in the esophagus. It provides a fuller picture of reflux activity. The pH probe test can be uncomfortable for infants because it involves placing a tube through the nose and into the esophagus. It also requires the infant to carry a recorder for a day or two, which can be stressful for both baby and parents. Deciding whether to use a pH probe depends on the severity of symptoms and how the infant responds to initial treatments. If symptoms are mild and improve with simple measures like feeding adjustments, a doctor might avoid invasive testing. But if symptoms are severe, persistent, or unusual, a pH probe can give valuable information. In cases where the diagnosis is unclear or symptoms do not improve, a combined pH and impedance test may be recommended. This approach helps identify whether reflux is acid or non-acid and guides more targeted treatment. In summary, a pH probe study is useful for detecting acid reflux in infants but does not catch non-acid reflux, which is common. It can be an important part of the diagnostic process, especially in complicated cases, but it is not always necessary for every infant. Doctors weigh the benefits and discomfort of the test against the severity of symptoms before recommending it.